Well,
and I know you
factors.
do.
I mean, I think one of them, and you and I are on the same wavelength with this on so many levels, it's education. And I am such a big advocate of, you know, even millennials, however old you are, when you come into the office, I feel that it's my job as your doctor to educate you on prevention, whether it's wrinkle formation, sun damage, just general care of your skin. And so it's not that I say, oh yeah, I can take care of your sun damage. I say, number one, why are you tan in the office? You need to have a sunscreen. And what is your skincare regimen? And I really go through a long list of things with them to educate and inform them of how to prevent these things, not just devices in my office, but things that they can do themselves to be proactive about this. And the second part of it is, if we are going to treat them, whether it's with neurotoxins or neuromodulators, dermal fillers, it's about respecting their facial proportions. You know, we see so much in the social media of distortion of facial proportions among celebrities, and their celebrity is almost elevated because of that. And I think that puts our millennials at such an unfair advantage because it creates a false expectation of what they should be looking like. So that's the second part of my visit with them, is to really inform them of, we need to work on not only addressing some of these things, but also respecting your facial proportions so you still look like you.
Yeah, and I think that's the main thing, because people, will come and say, well, this only lasts 6 months or 9 months. But you and I, who have participated in clinical trials and have looked at the data from clinical trials, know that when a study ends at 6 months, 9 months, a year, 2 years, that's when the study ends. So that's the claim they can make. But that doesn't mean that the product is gone at the end of the study. And having treated patients over time, we both know that those products can be there for literally decades after they're injected. And I find that when you change one thing, you change the way the person sees themselves. And sometimes that changes what they do next. And they end up looking nothing like their original self. So I think sometimes, I think this is one area where it becomes especially important, like even vital, to see a trained aesthetic physician such as, and I love that, we're colleagues in derm and facial plastics and plastics, that we come together and we help the public understand how important it is to see someone trained at the level that we are, to be able to assess and analyze exactly what's happening. Because when we see people over a long period of time, we can look at a daughter and the mother, as you mentioned in the beginning, and sort of get where the daughter is going from looking at the mom. And there's small, very subtle, literally millimeter changes we can make in the daughter to help her age beautifully, so that when she's her mom's age, she can still look like herself, look beautiful, look genuine and authentic and natural, and age beautifully, but not with the goal of saying, sure, you want Angelina Jolie lips and, I don't know, somebody else's cheeks and someone else's brows and, hairstyle. We can kind of put together this composite of people to see how that can fit on you. And this look of sameness that I'm seeing that's driving me crazy.
Yeah, we see that. I really think that's geographically isolating, that look of sameness. We talk about this every time we see each other, because we travel so much that we are on, like, I'm going to the West Coast tomorrow. I'm going to be in the middle of Southern California. We know geographically they have a different aesthetic, and it almost becomes cultish because they are around each other so much that they get used to that look and think it's normal. And as an outsider, we go there and go, oh, good God, these facial proportions have been completely distorted. What's going on here? And,
the Kardashians are beautiful, but they don't. Not everyone needs to be a version of a Kardashian.
Right. And, speaking of millennials, I have a lot of millennials coming in for lip enhancement. There's no doubt in my mind we know who's created that buzz, Kylie Jenner, and social media. And those lips don't look good on many people. There's probably 2 and 3 syringes in those lips, and that is very distorting. It looks good on camera from far away at some angles, but on an average, Georgetown undergraduate student or graduate student that's coming to see me, that's not appropriate.
That's actually a great point, because a lot of times when you see that selfie culture on camera, it looks very different, and obviously there's ways to adapt that as well. But but you're right, from far away on camera, it looks very different than watching somebody and meeting someone in person. And I think a lot of times we go for what we see on camera or on Instagram, not what we see in the real world. And it's two very different looks. And it it may look okay on camera, but in real life, it really does look distorted and unnatural and out of balance and proportion. Talk a little bit about that balance and proportion and what you look for in a millennial, because you know what, there really are times when it is appropriate to use these devices and treatments to help patients age successfully and beautifully and naturally. So how do you analyze and assess for that?
So when someone comes into me and they have concerns about preventing fine lines and wrinkles on their forehead and around their eyes, there are some people that are just inherently more expressive than others. And we see that all the time, and they're just more predisposed to forming, medium to deep lines within their area of their face. So I first look at that to see, number one, do we have line formation at baseline? If there is line formation, then I think it does merit a little bit of a higher neurotoxin dose, because we're looking to not only prevent, but we're looking to actively relax some of the muscle around some of these, the periorbital and the frontal muscles on the forehead. But if someone comes to me and they don't have any fine lines or wrinkles, but they're saying, I just want to prevent that from forming, I automatically drop that half the dose of whatever neurotoxin or neuromodulator that I'm using in the office, because I'm just looking to soften their look and not completely paralyze them, because I know that they're not super expressive. So that's how I tackle the neuromodulators, like the Botox and the Dysport or the Xeomin. And when I look at volume, that's kind of the next area of the face, the cheeks, around the lips, the perioral region. There's some people that are just tall, skinny, healthy, and they lack volume in their midface, no matter what age you are. And that does create a facial imbalance in some individuals. So it isn't unreasonable to say, this person's only 30 years old. Are you kidding me? Why would you put filler in their face? And it's because a fat pad's a fat pad, whether you're 60 or you're 30. And if that is a shrunken fat pad and you're skinny and you have facial imbalance, then it does merit some, preventative maintenance on including volume in their midface.
Yep, I agree. And one of the problems I have, and this tends to be in all ages, but it starts at a younger age, is that when you do a neuromodulator, and when we say neuromodulator or neurotoxin, we're talking about Botox, Dysport, or Xeomin, which when we inject it into specific muscles, we weaken those muscles, which can affect the movement of that, and that's how we can improve expression and retrain muscles, really. But unfortunately, when these products are FDA approved, we have to go for this certain improvement, and that means essentially no movement in order for the FDA to say, yes, I see a significant difference, and you can have that approval. But in the real world, that's not always ideal. But patients are trained because that's how the pictures are, like, look, I can move, look, I can't move, and now I've gotten the best result. But that's not really the best result. So how do you help your patients understand that the ideal outcome is still being able to move, but to rebalance and retrain so that their movements are more appropriate, not overexpressing in certain ways, but really moving in more natural ways that are true to what they're really trying to emote or express or convey?
I think establishing expectations, we do that on a daily basis in both of our practices, especially in the cosmetic realm. And there is something to be said about establishing an expectation with any patient that walks in your office, especially the millennials, because again, these are the people that are going on Instagram and going on social media and getting a false sense of reality. And they see these, frozen porcelain dolls on social media that are not reality. And regardless if they're using a filter or if that's their real face, it is my job to say, that's probably not the best look and it's not the most natural. And I think maintaining some sense